Every year, over 17,000 people are diagnosed with brain cancer. The central nervous system, composed of the brain and the spinal cord, enables humans to engage in simple, everyday tasks such as walking and talking. This delicate and intricately constructed system can be disrupted by a proliferation of cells known as cancer. When a cell loses the ability to grow and divide in a controlled manner, it divides rapidly and forms an excess quantity of cells known as a tumor. These aggressive brain tumors require extensive, invasive therapy such as chemotherapy, surgery, radiation, all of which can have detrimental side effects. An obstacle faced in the treatment of cancer is the blood-brain barrier, developed to protect the brain from outside toxins, but blocks 99% of potential therapeutic drugs, hindering the treatment process and causing many fatalities. Large molecules do not pass through the blood barrier easily, and most therapeutic agents are relatively large molecules. However, according to a new study in France, patients may now benefit from an implantable ultrasound device that can provide a much less invasive approach than traditional treatments. The ultrasound technology can be used with respect to two different methods: high-intensity focused ultrasound, HIFU, and acoustic targeted drug delivery, ATDD. These two methods use ultrasonic waves to transport molecules through the blood-brain barrier and to facilitate coagulative necrosis via thermoacoustic energy conversion. So, in order to understand this process, we must first understand waves.
A wave can be described as a disturbance that travels through a medium from one location to another location. As energy passes through the sound wave, particles of air are displaced side to side, parallel to the direction of energy transport. When the particles move parallel, the wave is longitudinal. Therefore, sound waves are longitudinal. So how do the particles move? As the vibrating wave moves in the forward direction, it begins to push on the surrounding air molecules, moving them to the right towards the nearest molecule. This causes the air molecules to the right of the string to be compressed into a small region of space. As the vibrating string moves the other way, it lowers the pressure of the air immediately to its right, thus causing air molecules to move back leftward. The molecules move rightward as the wave moves rightward, and then leftward as the wave moves leftward. Ultrasonic waves are simply these sound waves, but with frequencies above 20,000 Hz, above the normal audible level of human hearing. Ultrasonic waves are compressional, pressure waves that have the ability to shake and permeate through material, such as human tissue. This ability to disrupt the medium is due to regions in the air where the air particles are compressed together, and other regions where the air particles are spread apart. These regions are known as compressions and rarefactions, respectively. The compressions are regions of high air pressure, while the rarefactions are regions of low air pressure. This allows the wave to permeate the blood-brain barrier. Okay, so the sonic wave can go through the blood-brain barrier, but how does the sonic wave eradicate the tumor?
When an ultrasound wave moves through a medium, three actions contribute to the loss of energy: absorption, reflection, and refraction. These three factors contribute to the loss of energy known as attenuation. The primary reason for the loss of energy is due to the absorption of the ultrasound energy by the medium, which converts the wave into heat energy. The rate of ultrasound absorption depends on two factors: 1, the material through which it is passing, and 2, the frequency of the ultrasound. The rate of attenuation is given by the following attenuation equation, which gives the absorption rate. Attenuation equals A, the attenuation coefficient, times F, the ultrasound frequency in megahertz, and X, the thickness of material. Attenuation can be seen as increasing with an increase in frequency of the wave. The following equation is another attenuation rate equation. To understand it, power and intensity need to be defined. Power is the rate of energy transfer, and it is expressed in the units of watts as energy per unit time. Intensity is the rate at which power passes through a specified area, power per unit area. Intensity is the rate at which ultrasound energy is applied to a specific tissue location within the patient's body. Therefore, the rate of absorption, or the rate of attenuation, is the intensity. So in the following equation, the final wave intensity, or the rate absorption onto the tissue, can be modeled by intensity equals the initial intensity times e to the negative 2 times alpha, the attenuation coefficient, times z, the distance traveled through the medium. It can be seen that increasing the distance traveled decreases the intensity, and increasing the initial intensity increases the final intensity. A small rearrangement of the above equation yields the power density as the negative intensity over Z equals 2 times alpha times intensity equals Q. Power density here can also be seen as heat absorbed by the tissue or target as it is power per unit area per distance. This is power over volume. The equation illustrates that quantity of heat absorbed by the medium, Q, is directly proportional to the intensity of the ultrasound wave. The intensity is also inversely proportional to the area of the ultrasound beam is spread. Increasing the area decreases the intensity. Therefore, focusing the ultrasonic beams onto a fixed point relays a higher intensity, and a higher intensity gives a higher power density, which yields more thermal energy.
The high-intensity focused ultrasound uses these relationships. HIFU is similar to focusing light using a magnifying glass. However, it utilizes an acoustic lens to concentrate an array of intersecting beams of ultrasound onto a target, the target in this case being the tumor. We have just come to the conclusion that increasing the frequency of the ultrasonic wave increases the tumor's attenuation rate, absorption rate of the wave energy. Also, it was said that focusing these ultrasonic beams onto a fixed, smaller area relays a higher intensity, which gives higher power density, yielding more thermal energy. This thermal energy absorbed by the tumor can cause thermal ablation. Thermal ablation, or tissue damage, occurs when an acoustic wave enters through tissue and part of it is absorbed and converted to heat. This ultrasound wave pervades the blood-brain barrier, enters the brain, enters the tumor and tissue, is converted into heat. The heat causes vibrations that disrupt the fibrin matrix, eventually degrading the tumor. This is the process of HIFU.
Acoustic targeted drug delivery is much similar, but utilizes lower intensity waves which are strong enough to still permeate through mediums. ATDD is a method used in conjunction with chemotherapy that uses ultrasound energy to transport molecules filled with the chemotherapy medication to deliver drugs to the brain. With the blood-brain barrier, therapeutic agents cannot cross the barrier. However, the low-intensity focused ultrasounds produce low-temperature rises, which cause extreme restlessness and vibrations within particles. The vibrations caused by the waves loosen the tight junctions of the endothelial cells along the blood-brain barrier and allow microbubbles in the bloodstream filled with therapeutic medicinal agents to enter the brain. The right frequency of the wave at the right time allows the bubble to pop, releasing the medication into the brain.
This new, compact, implantable ultrasound device utilized properties of high and low-intensity ultrasonic waves to create non-invasive solutions to previously inoperable conditions. Welcome to the Sonic Wave Solution, the solution to eradicate America's second largest killer, cancer. We hope you enjoyed our video. Thanks for watching.